Welcome to the Health Channel, all health, all the time. I'm Kathy Buccio, coming to you from the Baptist Health South Florida studios in Coral Gables. We have a fascinating topic today. Did you know that adults in the United States dedicate over 10 hours a day to screen time? And according to 2016 Nielsen Company report, this number includes the time you spend daily on tablets, smartphones, computers, multimedia devices, video games, radios, DVDs, DVRs, and TVs. The list goes on. So what effect can the screen time have on your eyes? Well, joining us today to talk about eye care is Dr. Richard Simon, ophthalmologist at Baptist Outpatient Services. Welcome, doctor, and another fascinating topic, and you know that we have so much to cover with this. So let's start by kicking off and talk about computer vision syndrome. What is it? Set the stage.
Well, to begin, Kathy, there is a disorder, computer vision syndrome, loosely defined, and if I could define it for the people out there, it's computers seem to give you a lot of aggravation involving your eyes. Anything from itching, burning, headaches, etc. And so there really is something to it, but it's a very loose kind of science. There's so much complaint about it that it's got to be real, but it's not a real disease disorder we know about. However, there is something to it.
And what exactly causes it?
Well, no one knows, but here's the thought.
Okay.
Number one, it's very different when you're looking at a book. You are reading the Wall Street Journal as opposed to standing in front of your computer. As you know, a computer is like a flashlight. It is shining in your eye. If the room lights are out, it lights up the room. That is very different than looking at the newspaper, reading it while it's in front of you. So that's shining in your eye the entire time, and it causes people to do different things. It's been shown that you don't blink as much, so you get a slightly drier eye. And for reasons that we don't understand, that flashlight in your eye, meaning the computer screen, nonstop seems to cause some sort of aggravation or irritation, whatever you might want to call it.
Oh, and I feel as a society, we are so guilty of that. And research shows that between 50% and 90% of people who work at a computer screen have at least some of these symptoms. So, Dr. Simon, will you walk us through some of the most common symptoms of computer vision syndrome?
Well, when I see people, of course, what does the patient complain about to me? Well, first, there's blurred vision, some doubling of the image. My eyes are irritated, my eyes are red, my eye feel dry, and my favorite, which I get a lot of, the computer gives me headaches. Doctor, what can I do? It can translate even into neck and back pain because, as you know, if you're looking at a laptop or at a fixed screen monitor, you have to get at the right position. Get your chair up or down, sit forward, slouch.
It's that computer slouch. You're constantly like this, and you have to be.
Got to be sitting here in front of a keyboard. So I tell people, of course, that you want to just take breaks. You want to close your eyes for a moment, blink your eyes. Artificial teardrops, if you're on the computer a lot, is really, really helpful. It's not harmful to use. A variety of products out there, they're all just fine. And then close your eyes, look away from the computer, just stop what you're doing as opposed to being transfixed on the computer, even if it is a very important email or document.
And I love that you brought props, and this is a great prop because we want to know what is happening to the eye when we're seeing any of these symptoms. So show us here with the model that you have going on.
Well, the first thing, of course, is that this is a model eye, and this is the cornea that I'm pointing to right over here. We blink our eyes nonstop over the cornea, acts like a windshield wiper on an automobile, and if you have that staring, fixed, sort of crazed position on the computer, you won't blink as much. So the tear film on your eye is going to evaporate a little bit, and you will get drier eyes. It won't kill you, but you're going to feel it after a while.
You're going to feel it. Now, it's important to know we have a lot of viewers at home that are parents, and CVS is not just something that afflicts adults, it also affects children. So talk to us a little about that.
Well, children, that's another item altogether. For openers, there is screen time for adults and screen time for children. Adults sometimes have to have screen time, forgetting that they're reading the newspaper or reading Facebook. You have work. Children seem to be transfixed and love screen time. The American Academy of Pediatrics came out with what I call a black box warning on page 1 of their website. I'm not a pediatrician, warning parents about this. Some of the warnings are actually rather draconian, meaning a child under 3, 1 hour per day. So if we look at little children, I see in my office, parents shove an iPad in front of their face to shut them up, and they're clicking away, having a good old time. And then, of course, the American Academy of Pediatrics also warned, make it quality screen time. if we use an artificial, sort of almost humorous situation, if you had your 8-year-old child and you left him home for 24 hours,
right.
Honey, don't answer the door, plenty of food in the refrigerator, don't do anything, you don't have to go outside, try to take a bath at the end of the day, I'll see you tomorrow. How many hours do you think that 8-year-old will be on screen?
Oh, that baby will be on screen all day.
If he can
all
stay
day.
up, it will be 24 hours.
Absolutely.
But it'll be at least 16. You have to watch that.
I'm a little guilty of that as a parent. So, but when a patient comes in with new eye issues, how often is it because of screen time? And is this one of the first questions you get asked?
I get asked about it, but it's not one of the first questions that I ask. Computers are ubiquitous. They're just everywhere. Everyone's on them. So I don't ask unless it comes up in the conversation, Doc, my computer's killing me, and then we'll talk about what you can do. Getting a high-quality monitor has helped. The lower, there's called a refresh rate on a monitor. So the high-quality monitors don't flicker as much. It doesn't give you that strobe light in your eye. Sit at the right distance. I don't necessarily recommend glasses, but if you are talking about glare, yes, you can get anti-reflection coating on your glasses. Some people really seem to like that. If you need a prescription for glasses, well, as my daughter would say, duh, you have to have them in front of the computer so you can see properly. If you get a blurred image and you're out of focus to start, you're behind the 8 ball the whole time.
Absolutely. So, and according to the Mayo Clinic, this is something we were talking about a little earlier, smartphone habits may force doctors to ask patients a few more questions when diagnosing vision or neurological problems. So let's take a look at this package from the Mayo Clinic.
Our eyes all the time are trying to adapt to the light around us.
But take the situation of reading a bright cell phone screen in dim light to the extreme, and you have a case like the one Mayo Clinic neurologist Dean Wingerchuk documented in a recent edition of the journal Neurology.
What it was a patient who had gone for medical attention because she had 2 episodes where she temporarily lost vision in one eye.
The alarmed patient was wrongly diagnosed as having multiple sclerosis. In actuality, Dr. Wingerchuk says her situation was triggered by very specific circumstances.
She was lying in bed using her smartphone. She was really only viewing the phone with one eye. The other eye was blocked off by a pillow.
Called transient smartphone blindness, or TSB, Dr. Wingerchuk says vision generally returns in less than a minute as the 2 eyes resolve their mismatched adjustments to the light.
So this is actually not a medical disease or disorder, but it's a normal physiological phenomenon.
This with the smartphone is so mind-blowing, and we saw there with the ladies laying on the bed, which so many of us do, to check our phones. So what are some things that we can do to improve symptoms? And when you see something like that, what is your first thought as a doctor?
Well, first I thought that was a great clip and a good video. Number one, if you look at what they are doing, they're staring at the phone, and you watch how that lady's blink rate was very low. She's just staring at that phone. One of my favorite things that I look at whenever I'm at a red light, I say to my wife, look around and see what people are doing. No one's looking up. Everyone, even driving, is on the smartphone. So yeah, there's an overdose of it. There's no question about that. It is a little flashlight shining in your eye. And if you were to say to the doctor, well, doctor, every night for 35 minutes before I go to bed, I actually take a flashlight and I shine in my eye. What do you think of that, doc? Is that a good idea?
That cannot be a good idea.
We're not going to do that. This is just a flashlight with writing on it, so you have to just have some judgment and know what you're doing.
Absolutely. So we actually have a graphic here that's going to show us some of the treatments for computer vision syndrome. And if we can sort of walk through some of these, tell us what are some ways to correct the CVS?
Well, the first thing you do, of course, glare off the monitor is a real thing. You can adjust your monitor. You can make the font larger or smaller, etc. Get your working length from the computer to a point where it is comfortable. Don't get too close on it. Don't get too far away. We don't really have any hard information that there's radiation coming from the computer. I'm not sure I buy that one.
Okay.
But you don't want to get too close to it. And then get your settings right. But the main thing is just take a break. Close your eye, walk away, look up at the clock on the wall, even looking over here to see what's for lunch, then going back to your work.
Well, that brings me to the new rule. We've heard about the 20/20 rule, but now we have 20/20/20 rule. And that kind of ties into what you're talking about, taking the break, correct?
It's every 20 minutes, just look away, take it easy, take a break. We're all transfixed in what we're doing. Work is very important. Even if it is for fun, you want to just look away for a bit. A lot of workers are distracted. The phone rings and they do take the eye off. But if you're just locked alone there, you want to take a break on a periodic basis.
You mentioned earlier that not necessarily a fan of the computer glasses, but if you need them, wear them. So talk to me about computer glasses. Who would be a better candidate for those?
Well, the first thing, there's the over 40 crowd. The over 40 crowd has something called presbyopia. You don't focus up close as well. So if you're out of focus, you need to have glasses, and they need to be for the computer. You can, should you elect, have them made in an anti-reflection coating. I'm neutral on that, but if you think glare is killing you, go ahead and do it. If we take a look at a healthy 27-year-old, they probably don't need anything.
Absolutely. So it's more for the over 40.
Correct.
Correct. All right. When we come back, we're going to talk about eye care and how often you should get an eye exam and what are some ways you can prevent eye injuries. You'll find out when we come back. So stick around. And remember to visit our website, allhealthallthetime.com, where you can watch videos from previous episodes, submit questions for the experts like Dr. Simon, or learn more about the Health Channel on South Florida PBS. We'll be right back.
You have heard about breast cancer, but do you know BRCA? BRCA stands for Breast Cancer Susceptibility Gene. Everyone has BRCA genes, but some women inherit BRCA genes that have a mutation or a change. Women with this genetic change have a greater chance of developing breast and ovarian cancer than other women. About 50 out of 100 women with a BRCA1 or BRCA2 genetic change will get breast cancer by the age of 70. CDC offers a confidential web tool called Know BRCA that women can use to learn their risk of having a BRCA gene mutation.
Learning your risk for a BRCA gene mutation allows you and your doctor to make important decisions for your health. This may include genetic counseling and testing, enhanced screening, and other methods to reduce your risk of ever developing breast or ovarian cancer.
Enter your family history, learn your risk, talk to your doctor. Visit knowbrca.org to find out more.
C stands for cutting edge research, clinical trials, and collaboration. Creating breakthrough treatments as Florida's only member of the Memorial Sloan Kettering Cancer Alliance. At Miami Cancer Institute, C also stands for Cure, world-class cancer care right here at home. Learn more at miamicancerinstitute.com.
In Saudi Arabia, a genome research program is leading to major advances in precision medicine.
The Saudi Human Genome Program was facilitated by advances in technology, which provided us with the basis to rapidly sequence the genomes of individuals to understand the basis of disease, and this became easily related to the health and welfare of patients.
It's already helping doctors to more precisely diagnose and treat diseases like cancer, Alzheimer's, and diabetes. For more, go to thermofisher.com/precisionmedicine.
Welcome back to the Health Channel. I'm Kathy Buccio, and I'm here with Dr. Richard Simon, ophthalmologist at Baptist Outpatient Services. So before the break, we were talking about the side effects of screen time on the eyes. But let's dive into eye care in general. So according to the CDC, about 11 million Americans over age 12 need vision correction. Eye exams, why are they so important? We cannot neglect them. Is this correct?
Well, number one, even at any age, at a certain time, you should get at least one swing at the bat, have your eyes checked, make sure you're okay. Over other ages, if we take over 45 to 50, you're guaranteed to have something wrong. Some of the things are very dorky, and here's some glasses, use them when you're reading the newspaper, but some of the things are not funny. Some of the things happen to nice people. And if we take a look at visual impairment, what are Americans' biggest fears when we take surveys? Fear number one, cancer. That always tops the list.
Always.
What's number two? Blindness.
Blindness.
And blindness in my field is not rare, unfortunately. It's real and it's sad. So you want a lot of the things are, of course, preventable. Having an eye exam, you can get there first. We can get in there and do things.
So what are you looking for? You do an eye exam. Let's just say a regular folk walks in. What are you looking for? What are the signs?
Well, of course, it depends on who the patient is. If you're bringing me your 11-year-old, oh, goodness gracious, by statistics alone, that person's likely normal, but we'll look and make sure.
Absolutely.
If we're looking at that 50 and above, then we take a clean history, make sure you're not diabetic, you don't have hypertension, there are no other disorders like rheumatoid arthritis that can affect your eye. And then we're looking for some of the things that happen to the aging eye. Everyone's going to get a cataract over time, guaranteed. But there are other disorders that are out of the mainstream that you're not supposed to get ever. Macular degeneration is one, retinal issues are another. There are so many things, glaucoma, high pressure in the eye. Those are the things we look for.
Now, when it comes to depth perception, eye alignment, eye movement, are these key that can indicate something in a person's vision?
Well, depth perception, eye movement disorders is real common. I have a subspecialty in that, and that is going to take place even in early childhood, even some children 4 to 6 months old. In fact, if we look at birth rates, about 3% of children will have misalignment of their eyes, even out of the get-go.
Is that when you see the kids, young kids with the glasses, those gummy glasses that they put on them?
You wonder why would this little cute 18-month-old child be wearing glasses? Well, that's the reason. I operate on children, sometimes very young, if we need to correct that type of thing. Depth perception can be a real bugaboo and problem of navigating, doing this, riding a bike, but primarily it's for high skill issues using your hands. So that if you are going to be a dentist, that's one of the things they check when you apply to dental school, is you have to have decent depth perception.
Well, I need you to know where my teeth are. Absolutely. So what are common vision problems that you see on the daily?
Well, common vision problems, of course, would be based on age, and common things are common. Well, what's the most common thing? Refractive errors, that is nearsightedness, farsightedness, astigmatism. You can see, you're basically healthy, but you're not in clear focus. Astigmatism refers to an oval shape of the front of the eye.
Okay.
Glasses will help that. You can see, but you're constantly defocused. Nearsightedness means you can see well up close, can't see far away. That would be a typical 10-year-old kid
That's me.
in 5th grade who wore glasses at a very early age. Those are really, really common, affecting at least half of our public and even larger in certain segments. Asians, for example, particularly Chinese, a lot of myopia in that racial group.
Now, but all these are able to be corrected just with glasses or contact lenses, is that correct?
Correct. In general, not every
Okay.
single, but in general, you're right. Glasses, contact lenses, early diagnosis, you'll be pretty good, and you can go in either direction usually.
And not everyone's keen on wearing glasses. They want to wear contact lenses. So who would be the best candidate for contact lenses?
Well, in general, I like contact lenses. I like them for those who want them. I never subject my feelings that you should have contact lenses. But if you have a child, and my minimum age, in case you're curious, is 11 and a half, I will not go lower than that unless there's a medical reason. But if you talk about a 6th grader going into 7th grade, they want contacts. Oh, Mom, please. Highly motivated, looks pretty good, looks like they had a bath in the past couple of days, then yes, go to contact lenses. Highly motivated, go for it. Starting contact lenses at age 40 or 45, because I don't want to have glasses to read, that's a tougher issue.
Well, because of
not
dryness
impossible.
of the eye.
Dryness of the eye, you've got to be able to focus far away as well as close up. We have plenty of patients there, but not as many as age 13 or 23 for that matter.
Now, we sometimes turn to contact lenses because it's easy, but we also find the problem that people are not as apt to take care of their eyes when they're wearing contact lenses. This is something that we definitely want to talk about. And a lot of issues comes about cleanliness. So talk to us a little bit about contact lenses and how important it is to take out those contacts, to keep your eyes clean, to keep those contacts clean.
Well, I use that black humor. It looks like you have to have a bath in the past couple of days. And that is kind of funny. But no, you have to have hygiene correct. And what people don't understand is that my phrase I use in the office all the time, contact lenses is not nail polish. You don't like the nail polish, you take it off. Contact lenses poses a risk. Things can go wrong. most of the things that go wrong are dorky and clear up, but some things can go wrong, and some of them are not funny. You can change your life forever. You can have serious damage to your eyes with contact lenses, which is why I personally do not give them to 8-year-olds. And I don't care if your kid sings in the choir. I don't care if they're going to be on the cover of People magazine. I just don't.
Right.
But you have to understand that there is a risk. Now, the risk is low, and you can ameliorate things going wrong by really following the directions well.
Absolutely. And we actually have a first account story. Alabama football player Ryan first noticed a painful problem with his left eye on his way to a championship game. He had a habit of rinsing contact lenses with water if he didn't have disinfecting solution. And Ryan was diagnosed with acanthamoeba keratitis, an infection caused by an organism that lives in water. I mean, doc, that doesn't sound well at all. He now has a scar in his eye that makes it difficult to see and will eventually need to have a major eye procedure to correct his vision. Let's take a look at that.
My name is Ryan Paris. I'm from Madison, Alabama. I'm a junior at the University of Alabama. I first noticed that my left eye had a problem when we were about to play LSU and I was getting ready for game day. And I looked at my roommate and I said, "Hey, is there something wrong with my eye?" And he said, "No, it looks fine, it looks fine." But I was having like a lot of pain in it. And after that, like my eye started getting more and more shut every day. And I started feeling more and more pain. You know, I just thought it was another scratch, but I didn't know what it was going to turn into. About a month later, I went to the doctor's office in Birmingham, and she was like, "You have acanthamoeba keratitis." And I was like, "Okay, what is that?" She told me that some people experience like blindness, that very sensitive to light, and that basically it eats away at your cornea to the part where you can either just go completely blind, or you can have to have a cornea transplant, or you would lose your eye. And so, of course, I'm like, okay, well, all of those sound bad. I'd rather not have to do that. I was a terrible contact lens user when I was in elementary school, and I got better when I got to middle school, but it still wasn't very good. So I'd just wash them out in tap water or lake water or river water, wherever I was, because that's just a normal thing for me. I saw my grandfather had hard contacts, and I saw him do that all the time, so I'm like, all right, no big deal. So it was just another thing. I didn't figure anything could come bad from it. It was just water. Tap water definitely contributed mostly to the whole thing. That week, I ran out of solution, and so I just was using tap water. I mean, no big, just a normal thing for me. You know, right now I have a giant scar in the middle of my left eye from the infection. I cannot see directly in front of me. I can see peripherals pretty good, but I cannot see directly in front of me very well. If I covered up my right eye right now, I could kind of tell what was going on around me, but I couldn't really say like specifically who someone is. We're hoping that, surgery or whatever goes well to get that scar away from me so I can go back to seeing normal and maybe even wearing contacts again. If I knew more about, washing contacts and what, then I feel like this would have been 100% avoidable.
Wow. Things like eating away at your cornea, blindness. He probably can never play football again. When you see Ryan's story, what are your thoughts?
Well, number one, of course, he's never going to be normal again, and I hate to see a story like that. That is so sad. We talked about risks, etc. By the way, acanthamoeba, one of your worst nightmares ever. That's just what you don't want to have. And contact lenses, by their very nature, entail risks. Now, most of the risks are low, but particularly if you are meticulous about the care. If you looked at his story, he said, well, I wasn't really good about it early on, but I sure am good now, right? And you can get into trouble, even something as silly as just sleeping your lenses at night, which is approved by the FDA. You're allowed to. I tell my patients never, under any circumstances, do that.
And that is something that's very common. I mean, like I said, I'm very guilty sometimes of forgetting to take out my contacts, and I notice that stickiness, dryness in the morning. How bad is sleeping with your contacts?
Well, number one, it is FDA approved. You're not outside the norm. And if you insist on doing it, then I say, okay. Take them out every 2 days or 3 days. But when you do take them out, of course, your eyes feel gritty and sandy, etc. When we look at complications, things that can go wrong with contact lenses, when we look at things that are not funny, the majority of those patients, to the 99th percentile, are sleeping in their contacts. Those who wear them as a daily wear lens, you can get into trouble too, but not nearly as bad and that is the safer way to go.
Safe to say, though, no tap water, no river water, no any kind of water. Please stick to contact solution.
You have to be, and do the solution, of course, that is recommended for you. And whatever the doctor tells you, there's a reason they're telling you that. Don't say, "Oh, shucks, my friend doesn't do that." You have to do exactly what they say.
Absolutely. So now let's switch gears to eye diseases. They're common and can go unnoticed for a long time because some have no symptoms at first. So an eye exam is imperative for diagnosis. Is that correct? We don't see some of these symptoms.
That is correct. The classic disorder that we'd see with that would be glaucoma. Glaucoma meaning high pressure in the eye. Even the most astute, savvy, and intellectual person would not know about glaucoma. There are other things, of course, and let's talk about some of those.
Yes.
Common things are common. For openers, cataract. Well, cataract is going to happen to everybody. You will never escape that. If you're over 59, you're going to have some degree of cataract.
Okay.
It means that the lens is getting darker. Yes, I suppose it is a disease process, but we're all going there. Diabetic eye disease, that is a big problem.
That's tied to weight, though, correct?
Yep. That's only, of course, going to be in diabetics. Type 2 diabetes tied to weight. If you are diabetic, you must get into your doctor. Your ophthalmologist needs to see you at least once a year. That is a classic case of a stitch in time saves 9. If we get in early, we can prevent a lot of things. When it's late, there's trouble.
There's trouble.
We talked about glaucoma. Glaucoma means high pressure in the eye. That is never normal. You're not going to know it. The doctor's going to surprise you, and you're going to say, "What?" That has to be taken care of. It's progressive, and it doesn't produce symptoms until very late.
Can that cause blindness?
It will lead to blindness eventually
Lead to blindness.
if unattended to, and unfortunately, a lot of our patients come in late in the game and they're already partway down the drain to start.
So how often, then, do you recommend these eye exams so the patients don't miss something like this on their exam?
If you have a family history, my aunt, my brother-in-law, my brother, both parents had glaucoma, you ought to be thinking about that at around age 40, and you ought to be coming in yearly. Again, for normal people, a normal 16-year-old, what's the chance of that 16-year-old having a cataract
Low.
or glaucoma? Really low.
Okay.
What's the chance of a 58-year-old having something? Very high. And so, like older cars with 60,000 miles, cars with 80,000 miles, they will have things that happen, and so you need to have some maintenance, at least have it looked at on a regular basis. My golden rule I use, at age 60, you need to be coming once a year no matter what you have. If you have other factors, family history, if you're diabetic, you need to be coming every year. Even an 8-year-old diabetic needs to come yearly.
And that's a great comparison because what you're saying is older patients have higher risks.
Correct. You're guaranteed to have something happen with time.
Now, when we talk about children and their first eye exam, what do you recommend for parents? How early should they take their child to get an eye exam?
Well, for openers, there is no set and pat and established guideline, but different organizations have put out a guideline. I do feel that every child needs at least one swing at the bat, as I call it. And when should that be? By age 4. This is a kid who can talk, but still young enough that we can do things if you need to get in there and say, "Holy smokes, your child has the following thing." Does an 18-month-old child need to be seen routinely? Well, probably not, unless the pediatrician screens them. Pediatricians are getting better and better at that. They really screen earlier. I get referrals all the time. Most of the kids are normal. There's nothing wrong with them, but the screening was suspect. But at least, one swing at the bat before starting first grade would be a good idea.
And Dad said we started at age 4. And coming up, we're going to continue our conversation on other preventative measures you can take for healthy eyes. So stick around. Dr. Simon has more for us. And remember to visit our website, allhealthallthetime.com, where you can watch videos from previous episodes, submit questions for the experts, or learn more about the Health Channel on South Florida PBS. We'll be right back.
At Miami Cardiac and Vascular Institute, we're celebrating our 30th anniversary. 30 years of pioneering minimally invasive techniques. 30 years of hard work and dedication by our top-tier leadership and world-renowned physicians and clinical staff, creating a world-class comprehensive heart and vascular care center unlike any other, committed to our guiding principles of outstanding quality care, continuous innovation, and a drive to save lives. 3 decades of excellence are the foundation for our exciting new expansion, a state-of-the-art facility, a first-in-the-world environment, with the latest technology. Recognized as one of America's best hospitals, we're proud of our history and committed to providing the best care today and in the future. We are innovators. We are leaders. We are Miami Cardiac and Vascular Institute at Baptist Health, South Florida.
Wonder if you should get tested for colorectal cancer?
Is it really that common?
It is. It's the second leading cancer killer in the U.S.
I don't have symptoms.
It doesn't always cause symptoms, especially early on. And screening helps prevent the disease.
Oh? How?
By finding precancerous polyps so they can be removed.
But that test...
There's more than one screening test. If you're 50 or older, talk to your doctor about which one is right for you. Colorectal cancer screening really does save lives.
Welcome back to the Health Channel. I'm Kathy Buccio, and I'm here with Dr. Richard Simon, ophthalmologist at Baptist Outpatient Services. And many people take their eyesight for granted. Is that right, Doc?
Correct.
And as we age, we may notice a change in our eyesight. But there are preventive measures we can take to help your eyes stay healthy. So, what do you recommend when it comes to keeping our eyes healthy?
Well, going beyond just having your eyes checked by someone and being told you're okay, there are things that you should do, and there are things that we know. For openers living here in South Florida, you are constantly deluged with ultraviolet light. And we know from a large study done in 1982 up in Maryland that ultraviolet light does bad things to your eye. Everyone's savvy, we know, skin cancer, we're all hip on that with sunscreen. But you need to protect your eyes from ultraviolet light, particularly if you're an outdoor person, golfer, tennis player, yard cleaner upper, and particularly boaters. So ultraviolet sunglasses, hat, baseball hat, sombrero, whatever you want would be a good idea. That is the key thing.
And in terms of nutrients, because you always hear growing up, milk is strong for the bones, carrots are good for the eyes. Is this a fact or fiction?
Well, it is both fact and fiction both. So the story is the following. Most of the things we know about nutrition are based on opposites, like opposite day. We know that when you are depleted of vitamin A, you get a certain disorder, therefore vitamin A is good for you. But what can you do and what should you do? Because a lot of this is based on somewhat loose science. There's a lot of published study about it, and here's what I think you should do. Keeping a normal and balanced diet, not living just on potato chips, would usually do okay. The typical American diet, as long as it's not just, again, Pepsi and potato chips, you should be okay. We now get into the question of supplements. Here you must be wary of people trying to sell you things, and good for the eye, etc. There is no pill that you take that goes to your stomach, ricochets, and goes right to your eye. But what do I do as a consumer, having read all the literature? I think there's enough evidence that taking a daily multivitamin made by some major manufacturer, not something you bought off an infomercial, is probably going to help you, and it's certainly not going to hurt you. Most of the major manufacturers, they're all hip to it. They know it. If you look and spin those bottles at CVS or the vitamin shop, you'd be surprised how similar each one of them is. Most of them contain lutein or zeaxanthin, a pigment that's necessary for the eye. They all contain beta-carotene and some of the antioxidants. So I think there's enough evidence that taking one a day not 20 a day, probably over a decade or 2 or 3 will probably do you some good. Even if it doesn't do you good, it's not going to harm you, and that is the way I go.
And when it comes to actual foods, there are certain foods that help when it comes to eye health care, and we have here a graphic that shows us that. I would love for you to talk a little bit about kale, sweet potatoes. We have a list of 5 that are crucial for that.
Well, these ingredients on this list are excellent, and I'll go over why they're so important. And that brings up one question. Is it better to take the lutein in a pill form or get it by eating it? Well, kale and other leafy green vegetables, the dark green vegetables, have a lot of these pigments in them, zeaxanthin and lutein. And those are actually good for you, and it is not an old wives' tale. Sweet potatoes also does the same thing. Strawberries contains antioxidants that can be beneficial. Salmon and other fish contain fish oils. These contain omega-3 fatty acids. Omega-3 fatty acids are definitely beneficial for people with dry eyes. And in fact, people who do have dry eyes, I recommend they go to that or take at least a vitamin supplement. Green tea contains antioxidants, and these antioxidants can be helpful to the eye, which is why I like the multivitamin also.
This is such great information. I had no idea about salmon. Helps with the dry eyes.
Not specific salmon. Salmon's so ubiquitous you can get anywhere. It's salmon or any of the, quote, oily fishes have fish oil, and the ingredient you're looking for is omega-3 fatty acids, which you can also buy as a supplement too.
You made reference to this earlier, which was smoking. So how important is it to quit smoking? Alcohol, do they at all contribute to eye disease?
Well, we all know about smoking in the 1960s and lung cancer. That is no secret anymore. But smoking definitely is a no-no for your eyes for a variety of reasons. Number one, the biggest thing, it will advance cataract. I did mention that everyone will get some degree of cataract with time, certainly over age 59. But when you talk about smoking, you're putting kerosene on a fire. It's pedal to the metal. It's going to make it go faster. It also causes other issues on the surface of the eye, so if you want to do something for your eye health, that is an absolute no-no, including macular degeneration, which is not a fun thing to have.
We need to keep talking about cataracts. I feel it's something that you keep making a point that all of us at some point will have a cataract and will visit our doctor because of it. So let's talk about that. Why is this prevalent in so many people?
Well, number one, cataract is a normal part of getting older. Is it a disease process? Oh, golly, I guess so, but everyone's going to get it anyway. What you don't want to do is get it at a young age and be forced to have surgery. So that is the type of thing where I think that you really need to do everything you can in your favor. We talked about wearing sunglasses outdoors, ultraviolet protection. Cataract is becoming the number 1 most common operation on the Medicare budget as baby boomers get older. Cataract surgery is being done more and more, etc. Thank goodness it is something that can be fixed and cured. It is the number 1 cause of blindness throughout the world, particularly in the third world, and we're talking about rural Himalayas, we're talking about Egypt, etc. It is not the number 1 cause of blindness in America because people get to the doctor at age 62 or 68, and it's fixable with great results when we get it in time.
Now, before we dive in more into the cataracts, and for any of our viewers who are just joining us, Doc, please explain to us what is cataract, what is causing it, and you actually have an image that is going to help us better understand what cataract is.
Well, if you look at the graphic, the 3D image that we have, this is a great 3D image because if we look right in the center of the eye, that's actually done for a cataract. It's a little filmy, hazy. The lens, that's the lens in the eye, and we turn it to the side. The lens in the eye is inside the eye at about this level. In a 12-year-old, perfectly clear. This is more the lens of a 68-year-old or 74-year-old. So it gets harder to see, more difficulty, low light becomes tougher. Gosh, Doc, all I want to do is see the baseball scores on the bottom of my TV. Can't you please fix my glasses? When we look at that type of situation, yes, that's the problem. It's cataract, not your glasses.
So that film that you just pointed out, is that one of the symptoms of cataract?
Yeah, you won't feel anything in your eye. The only thing that will happen is that you will have vision that's not clear. You'll think it's something else. And your doctor will tell you. Now, I do need to make it clear, every cataract does not need surgery. Everybody in my office at 61 is going to have something. It only needs to be addressed when the vision really stinks.
Now, this is something Dr. Simon has mentioned, but by age 80, half of all Americans will have developed a cataract. Yearly, 3 million people in the United States have surgery to remove cataracts, making it the most common surgical procedure in the U.S. Let's take a look.
Cataracts are a normal aging process. We'll all go through it. It's kind of like gray hair and wrinkles. It's just a normal process that we all go through. But people start complaining, usually in their 60s and 70s, of difficulty with nighttime driving, glare and halos, difficulty reading, requiring more light, and then just loss of the vividness of life. The colors start to diminish and the details start to diminish. Cataracts are actually the most common cause of blindness worldwide. We're very fortunate in the U.S. to have advanced cataract treatments and measures available that other countries don't have. And it's actually the most common surgery performed in the United States every year, as well as in the world. We're fortunate to have the best outcomes of any surgical procedure in medicine, and we have very happy patients with very quick results. We're very fortunate now to be able to offer multiple modalities to treat cataracts. We're able to use lasers now as to just using a scalpel or a needle, which has given us a significant amount of precision with our use of our laser. The procedure itself takes anywhere from 10 to 12 minutes overall, and it's a very comfortable procedure. There's really no pain, and it's a very light sedation as an outpatient surgery. In the vast majority of cases, in 24 hours, the patient is seeing better than they've seen in many years, and the discomfort level is very minor for the first evening, and people can resume their normal lives within 24 to 48 hours.
And that was your partner right there, Dr. Lacayo, talking a little bit about the cataract surgery. Doc, who is the best candidate for this surgery that we were talking about?
Well, the cataract surgery is interesting. It's one of the few operations where your doctor doesn't tell you. In general, you tell your doctor, geez, doc, I can't see. Well, you have a cataract. Your only option is to live with it. If you're happy, if life is good, keep going. Otherwise, you need to have it done. So it can be done at any age. It should be done when the vision is not good, and can it be made better with glasses? I began my career in the early 1980s. Cataract surgery has evolved enormously. It is incomparable what we do now to what we did back then. Now it's really restorative. I will tell you that you can see better than you ever have, perhaps better than you remember, after cataract surgery. It is an exchange of a body part. This cloudy lens gets removed. We get an artificial lens.
I want to see that model. You actually brought.
So I actually bought one, yeah, and I have that over here in front of you. And this is what I'm pointing to is the small little lens implant. This is a much larger version of it, and I'll put that right over here. This is a larger version of that lens implant, and of course that lens implant's right at the top over there. So your lens gets taken out, new lens gets put in. This one is a representative of one type. There are different choices you have. When the patient does have cataract surgery, we'll give you a choice. This is what you can have. What would you like? Terrific way to go. Again, not everyone who has a cataract needs surgery. You're doing well. Keep going until the point where you're really not doing well.
That is phenomenal. And have you noticed a change in your eyesight? And if you're wondering if you're a candidate for laser eye surgery, that's going to be our next topic. We're going to cover that when we come back. So don't go away. And remember to visit our website, allhealthallthetime.com, to watch videos of previous episodes, submit questions for the experts, or to find out more about the Health Channel on South Florida PBS. We'll be right back.
You're gonna love your new birthday present. Are you ready?
Ta-da! Today, grown-ups will try anything to get kids more active outdoors. Good thing, since active kids have a better chance of building stronger bones and maintaining a healthy body weight. Here's an idea.
Let's go.
Get out there with them. A message from the American Academy of Orthopedic Surgeons and the Pediatric Orthopedic Society of North America, who remind you, for strong bones, activity runs in the family.
It's a teeter-totter.
In Saudi Arabia, a genome research program is leading to major advances in precision medicine.
The Saudi Human Genome Program was facilitated by advances in technology, which provided us with the basis to rapidly sequence the genomes of individuals to understand the basis of disease, and this became easily related to the health and welfare of patients.
It's already helping doctors to more precisely diagnose and treat diseases like cancer, Alzheimer's, and diabetes. For more, go to thermofisher.com/precisionmedicine.
Having a hard time figuring out where to go for your healthcare needs? Baptist Health South Florida has just the tool for you. Simply log on to baptisthealth.net/carevenience and choose your symptom. Within seconds, you'll be given several options you can choose from to get the right care at the right time. From locations and directions to scheduling an appointment, you'll have choices right at your fingertips. Now that's Carevenience, the cure for inconvenient care.
Many websites selling medication may look professional and legitimate, but the vast majority of sites selling prescription drugs are doing so illegally. Criminals use websites to sell counterfeit medications that may contain life-threatening toxins. Dot Pharmacy is a website verification program that helps you identify safe and trustworthy online pharmacies. Purchasing medicine online can be safe and easy. Just look for pharmacy to the right of the dot in website addresses.
Welcome back to the Health Channel. I'm Kathy Buccio, and I'm here with Dr. Richard Simon, ophthalmologist at Baptist Outpatient Services. And this hour, we've been talking about eye care, ways to keep your eyes healthy. But if you've noticed your eyesight has changed and you're tired of wearing glasses, contacts, well, laser eye surgery is something many people are turning into. And this is something that you see very frequently in your office as well. So tell me a little bit about laser eye surgery and who is the best candidate for this kind of surgery?
Well, to begin with, laser eye surgery, which frequently goes by the name LASIK, which is a specific type of laser eye surgery, but everyone uses that term. LASIK has been around for a while. It was first FDA approved in 1996. We're 20 years into it, et cetera. So I will give you the short answer of it. I like the procedure. I like LASIK. I like it so much, I had it done already.
Okay, so we got you talking about it.
Great for me. However, it's not for everybody. That should be made very clear. The majority of patients I see in consultation are not appropriate for it. The majority of patients who come in asking, politely roll my eyes, they would be 58-year-olds who see great, just can't read anymore because you got older. It doesn't work there. Who is it best for? Someone who has myopia, who is nearsighted, who wore glasses at age 11, can see great up close, but can't see far away. Those people do the best. It is useful for other things too, hyperopia, but the main one is myopia, and it is very effective for that.
So it sounds like I would actually be a good candidate for LASIK, and I'm sure some of our viewers at home are wondering if they're good candidates as well, but I think more importantly, we want to know how it works, what you're doing. What are you doing to our eyes?
Well, what we do, if we look at my little model I have over here, the very front of the eye, and I'll turn this sideways, the very front of the eye that I'm pointing to right over there is the cornea. What laser does, it reshapes the cornea.
Let's show that to our viewers right here. Let's move that to camera 2.
There we go. Reshapes that and makes the front of the cornea mathematically match the back of the retina, and that's what causes the blur. That curve doesn't match that curve. So it does it, so it's not a natural type thing. It doesn't make you normal. It makes the cornea now match the back of the cornea, which is what contact lenses do, except it's permanent.
Okay, so we talked about who would make a great candidate. Now we need to talk about what actually goes into the surgery. How long is it, and then if you're in there doing that surgery, what else are you looking for?
Okay, well, it's important, number one, like great battles, the generals made the decision the night before the battle. You have to decide, yes, this person has a decent chance of coming out really well. You can't have real dry eyes. The numbers have to be okay. There are limits to where we can go. There is a funnel, there is a gate. You have to fall within this parameter. If you're 2 diopters out of the bell curve, forget it. You are not a candidate for laser vision correction, maybe for other procedures. So if you have all of that and everything is an all system go and you want it, and please remember, as I told you, I don't talk anyone into this. If contacts work well for you and you're a happy contact lens wearer, gosh darn it, just stay with contacts. Contacts are great as long as you follow all the directions like we talked about. But if you're looking for a safe way out, then laser surgery is the way to go. That would be the way to proceed. So what we do at the time of surgery, the way in my office how we do, we have an all laser procedure. Some of the older techniques for laser actually use it's called a microkeratome, but if you can imagine a miniature meat slicer that slices across your cornea that has risks, they are still used throughout the United States, but the more modern way is to do it totally by laser. Laser separates the cornea properly, very safe to go. Cornea gets moved, we resurface it, place the flap back into position. Generally speaking, people can see pretty well even that afternoon, and certainly by the next day, people see really well enough to, honestly, to go back to work or drive a car. There are other variants that we use on lasers. Sometimes we do not make this cornea flap. That takes 5 to 7 days for the vision to get better. There's a right procedure for everyone, and everyone doesn't fall into the same category.
And we were talking during the break because I had mentioned there is some fear going into a surgery like this. What is your number one advice to someone who is contemplating a LASIK surgery?
Well, the first thing is, of course, you have to understand that you're not forced to have this. This is a luxury. Go for it. This is your chance. Everything is all systems go. If you are not even a little bit of a risk taker, if you are the type of person that just would not ever take any risk, Doc, I wouldn't do it. I'm telling you, I drive with 10 and 2. I stop full brake. Don't have laser. You can't have laser because something can go wrong. Now, it's rare, it's very unusual, but it can happen. You can be sorry you ever had it done. You can write bad blogs and bad Google searches all day long, and you can find people like that. In general, the vast majority of people come out just the way they want it. But there are things that can go wrong. Discomfort, dry eyes, blurred vision, worse than you would before. That can happen, but rare. So we talk about risks. When you do this, there's a consent form. You sign that consent form for a reason. I'm not a big risk taker. I don't gamble. I don't like Las Vegas. I had it done. I thought the risks were very, very low, even back then when I had it. The safety feature is even better now, but there is a risk. You have to know that. And if you do an internet search, you'll find people who were unhappy. And I don't think they're lying. I think they're real.
Yeah.
But the vast majority of people are thrilled by it.
So let's talk about the vision. You mentioned that some people see great right away, but it's very normal, and we should stress that it is normal that sometimes right after surgery, your vision is still a little fuzzy. Is that correct?
Absolutely correct. Certainly that day, forget it, Charlie. What I tell people, you should have refrigerator vision. Open the fridge, sit in the chair, maybe put in the TV, at least see the box, but you won't see great. LASIK is a procedure that you see very well, usually the very next day, within 24 hours. That's the procedure that most people want, but everyone doesn't have that. That is somewhere where people just do great the next day, like going in with blonde hair. Come out a day later, your hair's black. This is great. Right. There's a variation of it called PRK, and I do that at least in half my patients. That is a slower recovery. There are reasons why people have that. It's actually a safer procedure to have than LASIK. That's a 4 to 6 day recovery of vision, but even the very next day.
You can opt for that
yes.
treatment instead.
Patients can opt it, or the doctor will tell you, you have to have this. LASIK is not in your best interest because it's too risky for you. There are extra risks with LASIK that PRK does not have. They both have the same outcome, however. 6 months later, both groups see the same.
Just slower recovery.
Correct.
Okay, so let's jump into another treatment, which is the all-laser LASIK. Is that something fairly new? What is that?
Well, we say fairly new, certainly within the past 8 years, et cetera. Safer way to go. If you're going to have LASIK, I don't care where it is, in Miami, Atlanta, or San Francisco, I would demand that. The safety feature of that, the precision of that is great. Again, we used to use this thing called a microkeratome. It is still used around the country. It did work, and I had that done by that technique. The all-laser laser was not around when I had it. It is safer to use. I would demand that if I were a patient.
So let's dive into the new technologies that you have going on in your field right now, some of which are happening in your office as well. Talk to our viewers a little bit about that and what it is that you offer and what are we seeing in terms of eye surgeries?
Well, number one, we talk about LASIK. It's to go branch from there. There are people who can't have it. For example, you're very, very nearsighted. Oh my gosh, you got those Coke bottle glasses, you're off the scale. LASIK will not work for you. It goes up to maybe 8 to 9 diopters of myopia. But there are other things you can have. There are new, really sophisticated lens implants that can be used for those people with a pretty good margin of safety with excellent visual results. That was not available a decade ago. In addition to that, when we talk about cataract surgery, after cataract surgery, you can elect to have lenses that allow you to see very, very well far away as well as close up. The person who wants to watch the World Series while you're reading the Wall Street Journal, no glasses, that can be done. There are lens implants that we can put in the eye for people who won't benefit from LASIK, and those are primarily 55-year-olds who see well but can't read. There are lens implants we can put in the eye that really allow very good close-up and far vision. These are things that were talked about in paper and in theory years ago, but now are here at this time.
That is amazing. It's eyes wide open after a segment like this. Thank you, Dr. Simon. You have been a delight, and I hope our viewers enjoy that. That's all the time that we have for today. What an informative conversation. Thank you, Dr. Simon, for joining us on the show today. So please be sure to join us next time on the Health Channel. All health, all the time. And remember to visit our website, allhealthallthetime.com, where you can watch videos from previous episodes, submit questions for the experts like Dr. Simon, or learn more about the Health Channel on South Florida PBS. I'm Kathy Buccio. That's all for now. See you next time.